Malaria is a deadly disease that claims hundreds of thousands of lives each year. It affects millions worldwide, especially in poorer countries where healthcare resources are limited and living conditions are challenging. Children are most vulnerable, facing serious risks even with treatment. Their young immune systems struggle to fight off the infection, leading to severe complications. The good news is, malaria is preventable and treatable. Simple measures like using mosquito nets and taking anti-malarial medication can save lives. By working together, we can make a difference. Community efforts and international support are crucial in combating this disease. The burden of malaria goes beyond health, impacting economies and development. It drains resources and hinders progress in affected regions. Families struggling with malaria often face poverty. The cost of treatment and lost income due to illness can be devastating. Their communities suffer from lost productivity. But there is hope. With concerted efforts, we can reduce the incidence of malaria. With increased awareness and investment, we can alleviate this burden. Supporting research, prevention programs, and access to treatment are key steps in the fight against malaria. Malaria is caused by a parasite called Plasmodium. This microscopic organism is responsible for the debilitating disease that affects millions of people worldwide. This parasite spreads through the bite of infected mosquitoes, specifically the Anopheles species, which are the primary vectors of malaria. When an infected mosquito bites a human, the parasite enters the bloodstream. This initial entry is the first step in a complex life cycle that leads to the symptoms of malaria. It then travels to the liver, where it multiplies rapidly. The liver stage is crucial as it allows the parasite to increase in number before re-entering the bloodstream. From the liver, the parasites are released back into the bloodstream, infecting red blood cells. This is the stage where the most severe symptoms of malaria, such as fever and chills, begin to manifest. Several factors contribute to the spread of malaria, making it a persistent problem in many regions. Warm temperatures and high humidity create ideal breeding grounds for mosquitoes. These conditions are often found in tropical and subtropical regions. Stagnant water sources, such as puddles and ditches, serve as breeding sites for mosquitoes. These environments allow mosquito larvae to develop and mature. Poverty also plays a significant role, as limited access to healthcare and preventative measures increases vulnerability. In many affected areas, the lack of resources makes it difficult to control the spread of the disease effectively. Preventing malaria requires a multi-pronged approach, combining various strategies to effectively combat the disease. One crucial tool in this fight is the use of insecticide-treated mosquito nets, which are designed to kill or repel mosquitoes. Sleeping under these nets provides a physical barrier against mosquito bites, significantly reducing the risk of malaria transmission. Indoor residual spraying is another effective method, where insecticides are applied to the walls and ceilings of homes. This technique kills mosquitoes resting on treated surfaces, thereby reducing their population and the likelihood of bites. Early diagnosis and treatment of malaria are vital components of prevention, as they help to manage and control the disease. Rapid diagnostic tests can quickly identify malaria infection, allowing for timely and appropriate treatment. Effective anti-malarial drugs are available to treat the disease, ensuring that those infected can recover swiftly. Furthermore, community education programs play a crucial role in raising awareness about malaria prevention, teaching people how to protect themselves. By empowering individuals with knowledge, we can promote healthy behaviors and encourage practices that reduce the risk of malaria. Combating malaria requires a coordinated global effort. International organizations, governments, and healthcare providers must work together seamlessly. Research and development are crucial for creating new tools and strategies. Investing in malaria control programs is essential for saving countless lives. we must empower communities to take ownership of malaria prevention efforts. Community health workers play a vital role in educating and supporting their local communities. By providing them with the resources and training they need, we can significantly strengthen local efforts. A future free from malaria is within our reach. By continuing to invest in research, prevention, and treatment, we can make a difference. Let us work together to protect vulnerable populations. Together, we can create a world where malaria is a disease of the past.